As we grow older, taking care of our health becomes more important than ever. Because staying healthy as we age isn't just about preventing disease, it's about protecting our quality of life. But did you know that recent studies have found some routine medical tests, especially after the age of 70, might do more harm than good? Why is that? Let's find out. Today, we're going to talk about 5 medical checkups you should approach with caution after turning 70. Before we jump into the video, please take a moment to tell me in the comments, where are you watching from and what time is it right now? I love reading your comments and seeing viewers from all around the world. So if you're ready, let's get started because this information could help you avoid unnecessary tests and make smarter health decisions. And make sure to watch until the end because number 5 might really surprise you. 1. Cancer screenings. First on our list are routine cancer screenings like colonoscopies, mammograms, and prostate exams. These tests can be life-saving at a younger age, when early detection often makes a big difference. But after the age of 70, things can change. According to the National Institutes of Health, NIH, and the U.S. Preventive Services Task Force, most routine colonoscopies performed after age 75 show little to no benefit in extending life expectancy. That's because many cancers found at this age tend to grow very slowly, and most older adults will live out their lives without those cancers ever causing problems. On the other hand, procedures like colonoscopies or biopsies can increase the risk of bleeding, infection, or anesthesia complications, especially for seniors taking heart or blood pressure medications. Of course, if your doctor recommends a test for a clear reason, it's important to follow their advice. What we're talking about here are unnecessary screenings tests done simply out of habit, not medical need. So always ask your doctor this simple question: will this test actually change my treatment or just make me more anxious? Remember, early detection doesn't always mean the right detection. Second, unnecessary heart tests. Next on our list, the overuse of heart tests. We're talking about stress tests, coronary CT scans, and even angiograms. While these tests are often seen as safe, even a standard stress test can carry risks like irregular heart rhythms, lingering chest pain, or cardiac arrhythmia. If you have no symptoms such as chest pain, shortness of breath, or irregular heartbeat, most of these tests are simply unnecessary. According to the American Heart Association's 2023 guidelines, routine stress testing in adults over 65 without symptoms often leads to false positive results, which can result in unnecessary procedures or anxiety. So if you're not having chest discomfort, shortness of breath, or rhythm issues, it's better to discuss your situation with your doctor instead of getting frequent heart scans. After all, at age 70 and beyond, what truly matters is keeping an eye on your blood pressure, cholesterol, and daily activity levels. Here are some small but powerful steps to support your heart health. Take regular walks or do light exercises. Follow a low-sodium diet. Check your blood pressure regularly. Avoid unnecessary medications. Remember, trust your lifestyle, not just machines. 3. Unnecessary bone density tests. Next up, bone density tests, one of the most frequently repeated screenings among older adults. How often do you get this test done? Osteoporosis is common as we age. But once the diagnosis is made, repeating this test every single year isn't necessary. According to the National Osteoporosis Foundation, after starting treatment, it's usually enough to repeat the bone density test every 2 to 3 years. Doing it too often doesn't make your bones stronger. It only adds stress, worry, and medical costs. True protection lies in your daily habits. Don't neglect your vitamin D intake. Eat calcium-rich foods to keep your bones strong. Prevent falls by keeping your home safe and well organized. And try gentle resistance exercises like using elastic bands. They strengthen your muscles without straining your joints. Remember, strong bones aren't built in reports. They're built in an active, mindful life. Number 4, full body scans and unnecessary imaging tests. It's very common, especially among older adults, to think, let me just check everything and I'll feel safer that way. But most of the time, these scans are not needed, and you might be wondering, why not? According to a 2022 report from Harvard Health Publishing, routine full body scans rarely provide any meaningful medical information. Instead, they often lead to unnecessary biopsies or even surgeries that carry their own risks. What's more, did you know that CT and PET scans expose your body to high levels of radiation? For people over 70, that radiation can actually cause cell damage over time. So if you don't have any symptoms and your doctor hasn't specifically recommended the test, getting a scan just to be sure might do more harm than good. Sometimes peace of mind comes not from more tests, but from trusting your doctor and your own body. 5. Too many blood tests. Finally, number 5, getting too many blood tests. Blood work is incredibly useful when done under your doctor's guidance. But having dozens of tests every month can actually make it harder to interpret results and may lead to unnecessary worry. It's also important to remember that some lab values naturally change with age. For example, someone over 70 may have a slightly higher creatinine level, but that doesn't automatically mean kidney failure. In short, unnecessary tests can lead to misdiagnoses and unnecessary medications. Experts typically recommend just one set of essential tests per year: kidney and liver function tests, fasting blood sugar, cholesterol profile if needed. Too many tests don't strengthen your body, they only feed anxiety. In conclusion, staying healthy after age 70 isn't about getting more tests, it's about getting the right test at the right time. Focus on balanced nutrition, light physical activity, staying hydrated, and getting good sleep. Instead of unnecessary medical procedures, build habits that naturally improve your quality of life. This video is for general informational purposes only. Always make decisions about your health in consultation with your doctor. If you found this video helpful, don't forget to hit the like button and subscribe for more content. See you in the next video. Stay healthy, peaceful, and mindful.